Patient is in bed in an inpatient unit. Patient also has GERD, hypertension, cholesterol, and diabetes. CT scan revealed patient suffered a right hemorrhagic CVA and was admitted to the hospital. Speech-language pathologist was consulted due to medical history. Patient was originally on a regular THINS diet. Patient evaluated with suspected dysphagia and recommendations for an instrumental swallow test. Patient participated in FEES, which revealed signs of aspiration with THINS but safe swallow function with extremely thick consistencies. Speech-language pathologist recommended a pureed, extremely thick diet. Caregiver supplies the patient with restricted food. Patient is not complying and is eating an advanced diet. Speech-language pathologist meets with both to counsel them on the importance of diet compliance due to risk of aspiration and plan of care. Grandma sent me with her special lasagna just for you. She said a few plates of this and you'll be feeling much better. And I also brought your favorite coffee.
Well, well, this was sweet, but I don't know. My speech therapist said that I'm on a puree diet or something. I don't think lasagna is considered puree.
Puree, extremely thick. I don't even know what that would be. You have to eat to heal. You need energy. No amount of smoothies or whatever is going to get you enough sleep or enough calories for that. And besides, what's a speech therapist telling you what you can and can't eat? Your speech sounds just as normal as before. Don't listen to her. She doesn't know what she's talking about.
Well, I guess you have a point. One plate of lasagna couldn't hurt.
Of course not.
Is it okay if I come in to continue working on your swallow?
Yeah, I guess.
Oh, hi, I'm Pooja. I'm the speech language pathologist.
Hi, nice to meet you. I'm her sister.
Nice to meet you. So, I've been helping your sister improve her swallow. How are you feeling today? Are you in any pain?
Well, not in any pain, but my head, it's just been constantly bothering me to think that I just can't do anything like I used to. I feel hopeless. Am I gonna be here forever? This whole thing is just hopeless.
Yeah, you feel frustrated. Just remember, you had a stroke, which affects your speech, language, voice, and swallowing. And this is gonna be a long recovery process, but you are making progress.
Yeah, I guess you're right. I understand that this is gonna be long. I am glad my sister comes to visit me during this awful process. Actually, she was just bringing me some lasagna that my grandma made. She made it special for me, and it made me happy.
That's good, but do you remember that you're on a pureed and extremely thick diet?
Well, I mean, I remember kind of, but don't know really what that means. And my grandma made this special for me, and so I have to eat it.
It's just lasagna.
I understand. We'll go over the diet if you forget. And can you just tell me more about that and why you feel like you have to eat the lasagna?
Well, I mean, she made it special for me, and she only makes it on the holidays. She just wants me to get better.
Do you think that eating lasagna or drinking the coffee will actually help you get better?
No.
Why not?
Well, it doesn't fit into that diet thing you were talking about. I could hurt myself more, I guess. But my grandma's getting older. I missed her last birthday, and I feel bad about that, and I can't hurt her feelings again. Ugh.
But how do you think she would feel if you got more sick from eating the food?
Well, not good. She'd feel horrible.
So do you think she'd maybe want you to refuse the food instead of getting sick?
Well, yeah, definitely. I mean, she wouldn't want to chance it, and I guess I shouldn't eat it then. I'll just explain how it can make me more sick and just tell her that I appreciate the thought. I just hope she understands.
I think that's a great idea. I think it's important for you to put your safety first and concerns about your family's feelings.
Okay, but what does a speech therapist have to do with swallowing anyway? Shouldn't we talk to a doctor about this? I don't know how she can get enough food this way. Living off smoothies and stuff, it's just not enough for her.
I understand your concerns about your sister, but a speech language pathologist not only works with patients who have speech and language disorders, but also voice and swallowing.
Okay, but how do you know what she can and can't eat?
That's a great question. So she actually participated in FEES, and wait, I actually think I might have a handout. Okay, so FEES is a swallowing test that can objectively determine the type of consistency that a patient can or can't safely eat. And so what happens is that when a patient can't safely eat, it's most likely because they aspirated or penetrated. So when food goes down the wrong way, so can you see this?
Yeah.
Okay, so when food goes down the right way, it goes to the esophagus. When it goes down the wrong way, it enters the trachea. Now, if this enters the lungs, it can cause pneumonia, which is deadly.
Okay, so what happened during the evaluation?
Yeah, so during the evaluation, I put a scope down her nose, which allowed me to see her swallowing muscles and how they were functioning to determine the type of diet that would be safest for her. Let's go over the results. And if you have any questions, I know it could be difficult to understand, just jump in and ask. So when you trialed the ice and the water, you had some that was tinted green. It went down your throat, and what I was able to see through the FEES was that there was some, can you see this?
Yeah.
Yeah, we can use the same diagram again. So this is the tongue, this is the esophagus. There's actually some pooling in the vallecula area. So this means that the base of your tongue wasn't able to retract, and this caused pooling in the valleculae. There's also a lot of pooling in the piriform sinuses. So this is the part that's down here. This means that the cricopharyngeal sphincter, or that's the opening to your esophagus, wasn't able to push all the food down. There was also some water that even went through your vocal folds. So this meant that there was a problem with your laryngeal elevation, the epiglottic inversion, which is the part that covers the trachea, and also there's a problem with closing the vocal folds. So this meant that thin liquids, like water, which is what we were trying, were very deadly because it can cause pneumonia. So we don't want you having thins right now. So that's why things like water, or even actually, were you drinking this? Coffee aren't safe. And therefore, that's why I recommended a level 4 diet, which is extremely thick or pureed consistencies only. Does that make sense? Do you have any questions?
Huh, I never knew that that's what's happening when she eats, but thanks for explaining that.
So what have you been working on in therapy?
Well, we usually practice with, what was that? Ice chips and water.
Exactly. We're doing pharyngeal strengthening exercises. So this will hopefully help build her swallow with the goal to advance her diet. And hopefully she'll be able to have the coffee and lasagna if her swallow improves well enough.
Yeah, hopefully that happens quickly.
So I guess I can't eat the lasagna right now. I guess I'll give this back to you. Grandma would want me not to eat it. She wants me to be safe. I guess I shouldn't risk, my health.
Yeah, I agree with you. So what can she eat?
That's another great question. So actually on my way out, I'm glad I grabbed another handout. So this is the IDDSI kind of summary sheet. That's like the International Diet Standards. So I know earlier you were saying that you forgot what a level 4 diet is, so I can just re-explain that. So it basically means, can you see this too?
Yeah.
That it's pureed foods. So these are foods that are extremely thick consistencies. So it's things like mashed potatoes or yogurt or pureed meats, pureed vegetables, anything like that. Just remember that if the food, you have a fork and you press the fork against the food, the indentation of the fork should be still on the food, and then that's safe for you to eat.
Oh, thank you so much.
So when are you going to visit again?
I'm not sure. I was thinking about Thursday, but I have a lot of work this week, so I'm not entirely sure.
I was just hoping I could see you earlier.
You seem upset by that.
Well, yeah, I am, because I like talking to my sister. It would just be awful if your work got in the way of coming to visit me. Ugh, I'm just sitting in the hospital all day long doing nothing. I just get lonely.
Well, is there anything that you like to do by yourself while you're here?
Well, I guess I like to draw.
Do you think drawing could help pass your time?
I guess so. I used to do it a lot when I was younger, and I did like it.
That's great. Maybe you'll be able to get back into it.
Huh. Yeah, that is a good idea. Thanks.
No problem.
All right, well, I have to head out, so I'll see you later.
Bye.
Bye. Thank you so much.
Well, this was a great session. I'm glad that you're able to realize that your personal health is a little bit more important than protecting your family's feelings. So I guess I'll see you later this week for some more swallowing therapy.
Yeah, I'll see you then. Maybe I'll have some drawings to show you. Bye.
Sounds good. Bye.
The speech-language pathologist used a humanistic approach in cognitive behavioral therapy when counseling the patient. The humanistic therapeutic approach allowed the patient to come to her own conclusions that her health is more important than protecting her family's feelings. Cognitive behavioral therapy helped the patient develop a new way of reacting to her cognitive distortions of should statements, emotional reasoning, and catastrophizing. Should statements were eliminated because the patient was able to realize herself that she shouldn't have to eat the lasagna. The patient was able to realize that just because she felt hopeless, it didn't mean the situation was hopeless too. Lastly, the patient was able to realize that it would not be catastrophic if her sister didn't visit. The speech-language pathologist was able to validate the caregiver's feelings about concerns with the current diet recommendations through providing content knowledge about the results of the patient's swelling evaluation. Through this session, the speech-language pathologist successfully implemented counseling techniques in order to guide the patient to follow the diet recommendations.
And wait, is that my part? No.
No. I didn't say the my. I'm glad you're able to realize